Good morning. I'm Karen Lipson. I'm with LeadingAge New York. I appreciate Mr. Furnish's clarifications. I want to point out about this regulation and the vaccination regulation on your agenda today, that these regulations, along with the minimum hours and direct care threshold regulations you considered last month, do not recognize the staffing crisis that we are currently confronting in our long-term care system. You're all well aware of this crisis. We talked about it at length last month. There's a state of emergency that the governor has ordered. Unfortunately, the executive orders issued in relation to that state of emergency provide very little, if any, relief to the long-term care system. Unfortunately, again, throughout this pandemic, New York State has offered no financial support to long-term care providers to address skyrocketing costs and to address the vulnerability of the population we serve. None. Most other states raised their Medicaid rates for long-term care providers during the pandemic. New York State cut them. So last month, you considered the minimum nurse staffing hours regulation. That regulation is completely impossible to comply with under current conditions. That regulation was published in yesterday's state register, and as far as I could tell, it has no changes in response to the concerns that we discussed last month. That regulation would impose fines on providers, even if extraordinary circumstances prevent them from complying. And that level of fine is not required by statute. It is just in the regulation. So nursing homes need an immediate infusion of Medicaid dollars to continue to staff their facilities appropriately and to provide the care that their residents need. The regulations on your agenda today impose more fines on providers for to meet requirements that are in some cases impossible to comply with or duplicate fines at the federal level. So there's no need for additional layers of fines that are simply going to deprive them of resources that they need to serve their residents, and we need to focus on the residents. Turning to the personal caregiving regulations.
30 seconds.
The DAL yesterday did not reference personal caregiving regulations. It only referenced the typical regulation, the typical visitation. So we don't know whether these regulations, which are more stringent than federal law and than the state law, would continue to apply. We don't know whether we are currently in a state of emergency that would trigger these regulations. And facilities are also required under these regulations to collect information either quarterly or semi-annually. Administrators and supervisors do not have time right now to go around collecting information quarterly and semi-annually from every resident about caregiving visitors who are completely irrelevant to the current state of affairs, because every visitor that wants to come into a facility can come into a facility. So the personal caregiving visitors aren't, that designation is not needed right now.
For the last speaker, I was trying to follow her description. She says that there is a staffing shortage and that they need a major infusion of funding. Well, how would additional money address not having enough staff anywhere? I want to understand better the correlation. If we got more money, where would this additional staff come from?
It's a great question, because we are facing a very tight labor market. But the truth is, long-term care providers can't compete with other employers for staff because we rely heavily on Medicaid funds. In nursing homes, Medicaid pays for 72% of bed days. So we can't raise prices on commercial payers. We can't raise prices on individuals who pay out of pocket, because we don't have those types of payers. We have to count on Medicaid. And Medicaid rates have not been increased in 14 years, and they are well below the cost of care. And we can't compete with hospitals or physician practices or even retail sites for staff. So if Medicaid raised our rates, then we would be able to pay competitive wages and salaries to our workers. And don't forget, nursing homes don't just employ nurses and aides and physicians. They also need people to work in their kitchens and their dining rooms and in housekeeping. So we're competing with a whole range of employers for staff, but we don't have the luxury of raising our prices in order to pay our staff better, because Medicaid won't pay us more.
I move on to Ms. Lipson from LeadingAge. Same criteria and limits apply. Ms. Lipson, please go ahead.
Yes, thank you, Dr. Gutierrez. I'll be brief. I would echo the comments of Mr. LaRue and Dr. Lin that these requirements are duplicative of the CMS. Sure. These requirements are duplicative of the CMS requirements for most providers, and they impose a double layer of penalties on providers who are unable to comply because they have to staff their facilities some way. They have residents and patients who need care daily. And the penalties are not going to help them in assembling the resources necessary to recruit and retain appropriate levels of staff. The vaccination rates among providers look good in the data presented by the Department of Health. 94% vaccination rates among staff in nursing homes and adult care facilities. But what those data failed to show is the denominator and the trend in that denominator. And anecdotally, we believe that long-term care providers have seen a shrinking number of staff since the pandemic began, and that number of staff has declined more sharply since August when the vaccination mandate was announced. And so with the shrinking denominator, of course, you have a higher percentage of vaccinated staff, but the shrinking denominator is not a good thing for residents or patients. We do not oppose a vaccination mandate. We want every staff member and every resident and patient to be vaccinated, but the state needs to be cognizant of the challenges that providers face and the needs of patients and residents. That's all I have. Thank you.